Okay, so 17 years ago, I introduced a program utilizing real-time segmentation for brachytherapy. And we published after that a paper on deflection and deformation, the majority of which happened with needle insertion. So it wasn't the setup and the template registration, it was actually the needles pushing the prostate and deforming it. So how do you compensate for that? Or can you come up with a mechanism to compensate for that during the procedure?
So that'd be interesting. I mean, I'm trying to think of.
So honestly, this is real time. So you have your fusion done. It depends on your vendor. We
use Eigen, yeah.
I don't want to. Yeah, just it depends on your vendor. I take only 2 biopsy cores and I try to hit it down the most high risk portion. So if the ADC map is really low in a specific area, I focus on that part of the lesion and I watch my needle go. And if I see if it curved or deformed, that I make an adjustment. I also do transperineal biopsies with fusion as well. I use the deflection to sometimes get around that little area where the puborectalis muscle pulls up the rectum so you don't go through the rectum doing transperineal. So I don't mind the deflection as long as you watch it happen, and it depends on the amount of deformation, the type of unit you use. I don't have a problem with it.
Right, and I think thinking about the question again, we create the fusion, and then we're biopsying in real time. So the fused image would be moving with the needle, and I can't imagine that the needle is moving it. That's creating that much of a change with respect to internal, targets. But it's something that we can look at.
But you should watch. So if you're at the peripheral zone, you have a posterior lesion, and you fire, and it's a very dense, high-grade disease. It could bounce off. So you need to keep your eyes on the ultrasound.
I'm not talking about needle deflection. I'm talking about prostate gland.
No, that's what we're saying. We realize that's exactly what you're saying. That's what we're talking about.
It doesn't have that, as long as you control what's going on.
And then you control as the biopsy goes in terms of their swelling. So you're always having to come back to your initial ultrasound registration. Right?
And I don't use elastic warping. I think that's overplayed, because if you change the truth of how good an MRI is and you start stretching and moving things around as you move through your procedure, it could limit your ability to sample those areas.
That's why this algorithm would get rid of the need to do that. Exactly. Yeah.